Good morning, everybody. Welcome to the October Halloween version of the Survivorship Lecture Series. Today, I'm very excited to bring Lisa Seaman, licensed acupuncturist, who has been licensed since 2005. She graduated from the Midwest College of Oriental Medicine in Chicago and completed a doctorate program with 5 branches of university in San Jose, California. For more than 10 years, she worked in women's health, treating IVF patients in the fertility centers of Illinois and in integrative gynecology practice. But for the last 6 years, she's worked at Cook County Health, right across the street from UIC in Chicago, as part of the anesthesiology and pain management department, and is currently the project director for the SAMHSA Award about acupuncture in the emergency department, which is an initiative to explore non-opioid analgesia strategies for pain management. So, welcome, Lisa, and we're excited to hear about the use of acupuncture in cancer survivors. Thank you.
Okay, yes. Um, well, I do have a little slide deck that we can share. Ben's going to advance the slides for us. And actually, what I prepared is more of an overview of just what our work is here at Cook County. And some of you might be more familiar with what we have to offer, and others may not. So I just thought I'd give you an overview of the acupuncture department here at Cook County Stroger and some of the projects we've worked on, one of which was working with cancer survivors. This is basically a talk that we've put together with the input of Dr. Urasek. And he likes to talk about acupuncture as being principle and precision-based medicine, that it's a very specific type of treatment that we do. And, we do see different results with our acupuncture strategy. So there's a whole strategy complex that we utilize. So that's basically the principle of our talk today. Next slide. So Dr. Yursek likes to talk about this being a fusion medicine. It's combined with a high touch and high tech. So it's based on the principles of blending kind of the Eastern and Western concepts in more of an integrative approach to medicine. Next slide. So, he likes to give an overview of the principles. There's some basic principles that we look at. We're looking at, two opposing factors of energies. We look at, maybe a depletion of the yin, or, an excess. People can have excess, which is the yang. And so those can be a balance between, having those two different presentations in a patient. And we look at, the 3 colors. We look at the complexion of patients. We do our exams. 3 colors also refers to like the 3 burners, the top, the middle, and the lower body. So we're looking at the whole structure of the body. And our 4 exams are, of course, typical for any exam: inspection, palpation, oscillation. We're looking at what we're hearing from the patient, percussion. So, our exams are usually looking at these types of exams when we make our diagnosis. We look at the phases. That would be also referring to the 5 phases. This looks at the whether a person has more of a composition based on nature. It's like a wood type, or a liver type, or we have the kidney type, which is water. And we look at these 5 principles. I wish I had the slide here of the 5 principles, but those look like the generating cycles, and the cycles that are maybe out of balance, and so they're not generating. And so we look at these 5 phase elements. Then we also look at extraordinary vessels. Those are, some additional meridians which are based on different a connection of those different five phases. And it is like a 12 meridian system, which when you look at the meridians, they're kind of similar to like the vascular structure. So you'll see some of the vascular structure, and then you'll see basically points on that vascular structure. If you have an image of what those meridians look like. Next slide. These are just a few points that were on the acupuncture points. There's over 365 acupuncture points. There could be as many as like 500 points with different systems, and so we have a lot of points to choose from. And we talk about a few of the points and maybe their common interactions. And so there is a point on the bottom of the foot, and it's for really reviving a person, and also it helps to turn the fetus for a breech birth. And so this is one of the first ways that we can use acupuncture, even at the fetal level of helping to support the fetus. And then another point would be the liver five, the termite hole. And that it has the characteristics of wood, bringing more flexibility, strength to the body. And it can also, this meridian kind of runs through from the bottom of the foot all the way up through like the torso. And it can help also work with genital issues. And it's really a good blood mover. Then there's kidney 25, which is kind of the storehouse of the spirit, and it's good for the chest. It calms the mind, and it's used to treat the opposite end of the channel. Again, this meridian goes all the way from the foot and then comes all the way, up the body. Ding Xuan is for breathing, and that's also used for any kind of upper respiratory problems, asthma, cough, shortness of breath. And it's on the back of the body, so it can also be used for back pain. And Urjian is on the top of the ear, and that's used actually to clear heat. And so anybody that has like sweating or has any kind of a skin condition like shingles, like rashes, this is very good at treating things like that. So next slide. Also, we like to talk about the neuroplasticity aspect of acupuncture. What's fired together is wired together. And so this is working with these scalp acupuncture, actually. And it's working with attention, intention, and rehearsal. So first of all, we give attention to where the problem is. And then we have an intention where we place the needle, and then we have rehearsal. We manipulate the needle with a scalp acupuncture. There's putting the pins in and then having some movement. If the patient is having difficulty walking, like with back pain, you'd have them then stand up and walk a little bit with the needles actually in place on the top of the head. And or if the shoulder is locked up, you'd place the scalp acupuncture and then move the shoulder. So that's really working with the concepts of neuroplasticity and waking up other parts of the brain to actually facilitate the movement and start to release different areas. Next slide. Also, in addition to the points on the body, we have these other microsystems, and so it's a hologram. The parts contain the whole. So there's a whole mapping system on the scalp, and a mapping system on the ear, where the whole body is kind of mapped out on the ear. So you can treat the whole body on the scalp, or on the ear, or on the hand. There's an abdominal acupuncture. They call it like the sacred turtle. And then there's Dr. Tan's matrix, where he has really a whole system of working with the body based on different point combinations. So these different systems can be utilized. They can be paired with the acupuncture on the body. They can be used individually, and they can be combined. But so there's a number of different ways that we can use acupuncture depending on the presentation. If you're working with an amputee, you might not have access to acupuncture on the body, so you would maybe pick a different system. Frequently in the clinic, we see presentations of patients in wheelchairs, so it's difficult, to see if they can get on the table. We can treat them right in a chair without having to move. Um, with some of these other systems, with the hand system or regular system or the scalp system. So sometimes it's good to have these other systems available in our treatment strategies. Next slide. This is just a brief introduction of kind of our infrastructure at Cook County Health. So we kind of talked a little bit about, acupuncture and how to practice. But, the practice began here at Cook County in 2011. It initially came in as part of the pain management strategy to reduce opioid use. It was a JCO mandate at that time. And so they were looking at more integrative ways to support pain management through the integrative approach. We also have a staff psychologist. So we in our pain department, and so we work with different groups for how patients with chronic pain or acute pain can help manage their pain through some breathing exercises and meditations and group therapies and individual therapies, as well as the acupuncture points or acupuncture treatments that we do, the treatment strategies. So our department first started in 2011 with Dr. Torres and Dr. Voronov. They were kind of the champions they both since retired just this past year, both in the same year. So now we do have a new interim chair for anesthesiology and a new chair for the Pain Management Center. Both doctors have been with Cook County for a number of years and are also, very helpful in our practice with integrating acupuncture. Dr. Urasek has been the director of acupuncture since the onset, since 2011. He was my teacher back in 2004, when I was a student. And so I'm very happy to still be here working with him. And so we hope to have him here for some time. And initially, when the program started, we were really insulated in the pain department, and all referrals, came through the pain department. And this past few years, we've opened up the referral process, so now all physicians from any department can refer to acupuncture, and so that has really expanded our scope in working with other departments. We're still within our home. We work with perioperative, and that we're working with referrals for inpatients, and we do consults with the ICU and the emergency department. And then we're also working with these outpatient clinics of the musculoskeletal, the neurology, nephrology, and oncology. And then, of course, family medicine. Those seem to be the primary departments that refer to us regularly. Next slide. This is where we move into our research that we've done in the last couple of years. Our first actual research project here was with the oncology department, and it was this study on xerostoma. It was a multi-site study that was done through the initiation of Wakefield Forest. And they are the primary authors of this article, but we were one of the sites that was for xerostoma. And we had very good results in working with the xerostoma, and the results of the study did show that this was a sham study also, and the results of the study did show that the actual acupuncture, the true acupuncture, did work better than the sham. And it was about bringing back saliva after patients had been sometimes for many years unable to really eat and have solid foods. And so we saw some astounding results from the study just in our location. Next slide. And the most recent study we've been working on was a study from SAMHSA, or in support from SAMHSA. We received a study, a grant to study acupuncture in the emergency department as an alternative to opioid use. And the SAMHSA alternative to opioids use could be any type of intervention. And so we were one of the few studies in this cohort that had decided to use acupuncture, as well as harm reduction and motivational interviewing with our patient population. And we had some very good results. So we kind of branded or named our program Pearl, which was pain elimination through acupuncture research and learning. And we did see that a very high satisfaction rate with the patients as well as the providers. And the providers in the emergency rooms, they have restrictions now on opioid prescribing. And so they were very happy to have some of these other tools and resources that they could avail themselves with in treating patients that were in the emergency department. And so our strategy had not only a one-off in the emergency department, but up to 8 clinic visits as well. And so it was having that clinic support that I think was most key in this study for the patient satisfaction, because sometimes these, acute or chronic conditions are not resolved in just the one visit to the emergency department, but having these other appointments in the clinic really helped patients feel more stable, and we were able to get their levels down to a more manageable level as they were waiting for referrals for other departments. It could be also from their trip to the emergency department, referred to physical therapy and referred for neurology. And while they're having their care coordinated, they were able to have frequent visits with the acupuncture department. And so I think that it also improved their whole philosophy as far as feeling cared for by the entire system. And so actually, we've stopped enrolling in this study June 30th. And at this point, we're doing our manuscripts for publication and our final reports. So we're kind of wrapping up the study, and we do have a number of departments in the that are interested in collaborating on future work with us. Next slide. These were just some quotes from Dr. Yurosek that he usually likes to talk about. He quotes all the way back to Socrates, and just the wisdom in knowing what to do and don't do what you don't know. So it's basically kind of let's stay in our scope and know when it's appropriate for us to treat patients, and know maybe when we need to pass the ball. And so from my perspective, working with the emergency department was really valuable. There were places where certainly acupuncture has a place, and then there are certainly other instances where we need more interventions, and so it's really working together as a team and seeing how everyone can bring their skill set to the table. Okay, next slide. These are a couple of books that we like to recommend, and The Sparkle Machine is a great book, and it's written by somebody from from the UK, and he does a really good job. This doctor of just kind of describing, how acupuncture works it, and from the past, and then how it's integrated into Western medicine. And then there was, some information on neuroplasticity there. And the ghost in my brain really talks about how this person is a personal life story, somebody who had devastating kind of accident, and then, was really disabled for a number of years, and then really was able to kind of bring their life back with these concepts of neuroplasticity. Next slide. These are our contacts, and these are the number of people in our department. So, of course, we're supported with our director of acupuncture, Dr. Frank Urasag. We also have Young Han, who works primarily, everybody works in the clinic, but everyone has some special projects that they're working on as well. And so Han usually provides support with the PACU. So we're doing some studies with post anesthesia care unit, and that's for patients that are either preparing for surgery, or they're coming out of surgery, and there are a number of studies that have shown the efficacy as kind of an EROS protocol, enhanced recovery after surgery, where that's something that we're kind of exploring at this point in our hospital, and our position within anesthesiology, of how to help and support patients after they've had surgeries. Bruce Hsu has just also been working on a long COVID study at the Core Center, and he's been working with basically the long COVID patients, and helping them to basically be more functional, and so that's been an ongoing study for the past couple of years. And my field of study at this point has been with the emergency department, and providing more of the acute care pain. And during that process, I've also worked with Ben Nugent, and Ben has been part of our team as well, and has continued on since the study's wrapping up, as just support for the whole department. And his background is more as a professional counselor, and so he provided like the harm reduction and the motivational interviewing, and works with patients on just the qualities of life, diet, exercise, sleep, and giving them support materials. So that's pretty much our team at this point. And next slide, I think, is just to thank you for inviting us to share a little bit about our work. And, we're excited to do more work with oncology. And we are working within our own team here at Cook County Health, with our oncology department, and look for future collaborations.
Thank you, Dr. Seaman. This is great. And I recently attended a virtual game course. It was a talk by Andrew Weil, the father of integrative therapies. And he said he
Yes, I think
recently visited
I
Japan.
attended that as well.
You
Mhm.
did? Yeah. And he had that story about visiting the hospital in Japan, and
Mhm.
how he was on the floors and it was just all so integrated. And there was
Mhm.
acupuncture and mindfulness and everything for patients, the supportive therapies like this. And it's great that we're finally seeing this vision and finally bringing this to fruition. Can you talk a little bit more about the indications, like the side effects from cancer treatment that you see acupuncture helping patients with?
Well, yes, it's very, as you mentioned, Dr. Andrew Weil's work, which is seminal, really. I mean, he's been for over 20 years really promoting this model of integration. And so one of the things that, acupuncture is most known for in cancer survivorship, or in treating people that are going through cancer treatment, is the nausea and vomiting. And so it does help people to be able to, eat, and to be able to keep food down, and it helps them to increase their appetite. So, that's a very food is the first medicine. So, being able to nourish ourselves is very important, and the acupuncture can help with that. Is really, you know, value. And then I think there's also the pain issue. So a lot of cancer patients experience pain, and acupuncture has been well researched as a pain analgesic strategy. And so those two things I think are two ways that we can really support cancer survivors and also patients that are currently in cancer treatment.
Yeah, and patients also with issues getting nutrition and having digestive problems and digestive side effects from treatment, not just nausea and vomiting too, but poor appetite, right?
Yes.
And
Hmm.
neuropathy. I've
Yeah.
always heard of acupuncturists that specialize in neuropathy because I have a touch of neuropathy myself. And can you tell me a little bit more about that?
Yes. So the neuropathy, of course, is the numbness in the hands and feet, and it actually can be quite excruciating for patients. And so there are varying levels of it. And so that's where you're working with kind of the nerve endings. And when any patient comes in with neuropathy, I like to show them like the dermatome charts. And so they can see that these nerve pathways are kind of linked to the spine, and that, maybe by treating these other areas that we can affect the extremities. And so, sometimes that's a revelation from them. Nobody has really explained that to them, or they weren't aware of it. And so when we start actually working with these distal places and working with these areas close to the spine, which then send the cell nourishment to the extremities, then they begin to feel a reduction in that neuropathy.
Right. Um, Does anyone else have any other questions? You can unmute and just ask your question, Sony. You are biting at
Yes,
the.
yes, thank you. Thank you so much, Deborah and Lisa. Thank you so much, Sony, founding director of Center for Health Research. So Lisa, we work with OSF healthcare system very closely. As you will be aware that OSF has built their new cancer institute here in Peoria, and uh, um, my center, which is only 1 year old, I moved here last year from Virginia. So we will be creating a footprint of this Center for Health Research, within the Cancer Institute. But we have already started working. My grant is on predicting breast cancer reoccurrence rate using the AI model. So what we are doing is we are taking patients from the OSF's survivorship clinic, which is called as a START clinic. Those patients who are under remission, I mean, those ladies who had cancer, breast cancer, and are under remission, we are recruiting them and we are collecting all the data. I mean, demographic data, data on social determinants and everything. And then we'll create a model to identify who are the patients who are at the risk. Currently, as far as I know, START Clinic of OSF, their survivorship program, does not have acupuncture as as an additional add-on therapy. My question to you is, um, how, how integral it is to incorporate acupuncture in survivorship clinics, because otherwise, if this is, then definitely I'm going to pursue them to kind of be in touch with you and receive some guidance from you.
Yes, in particular for breast cancer, there's usually a medication that's required for 5 years.
Correct.
Um, and so that medication, the side effect of it can be joint pain. And so there are some studies that have shown that acupuncture helps patients stay on medication and stay in treatment by reducing their pain levels. And I've worked with some of those patients that, they were ready to just stop the medicine. And they're like, I can't take it anymore. And then we started working with it, and then their pain is diminished, and then they continue on with their treatment. So I think in particular, working with cancer patients, survivor patients, is very important.
Thank you so
Yeah.
much, Lisa. Yeah, that's great. Thank you.
Okay.
Yeah, can you tell us, actually Judith was talking to us. She works at UIC and taught in multiple trials of incorporating acupuncture into into the clinical side of medicine. Can you tell us more, Judith, about what you have learned about the incorporation of this?
Sure. So our first study, which was funded through NCCIH, the National Center for Complementary and Integrative Health, was to determine the feasibility and acceptability of acupuncture for breast cancer survivors, for underrepresented um, breast cancer survivors who didn't have access to acupuncture. And Dr. Dansu is also a co-investigator on the study, who is a breast oncologist at the UI Cancer Center. And we recruited from the Cancer Center as well as Miles Square. And so we're writing an R01 now to continue this work. So we actually, our work is on determining something called the psychoneurological symptom cluster, which, as Lisa and Dr. Dodani are well aware, it is not only joint pain. These are on women. This study is particularly focused on women who are on aromatase inhibitors, which Dr. Dodani and Lisa are well aware of. So the psychoneurological symptom cluster that we've characterized is joint pain, anxiety, depression, sleep disturbance. Some of these women additionally also have hot flashes. And so we created a standardized acupuncture protocol, actually a semi-standard acupuncture protocol, meaning that everybody who had all those conditions, we made a balanced protocol and addressed all those problems with the balanced standardized acupuncture protocol that everybody got. And we used acupuncture twice a week for 5 weeks for a total of 10 sessions. And so we also added, the patients were able to add up to 3 points. So if they had particular pain, in the hip or the hands or something, we would add additional acupuncture points. And so we've just analyzed those results where we've submitted our manuscript for publication, which shows that not only is acupuncture feasible and acceptable in underrepresented patients who are breast cancer survivors on aromatase inhibitors, but also in our post hoc analysis, we found that acupuncture indeed was efficacious for the reduction of those conditions as well. So we're now writing an R01, which we'll be submitting in January. And so that's just one of our studies. We have another study that's funded through NCI on breast cancer survivors as well. So, and Dr. Dodani, it's so exciting to hear about your work. I and Lisa as well. So exciting to hear about your work. And I'm not as familiar as Dr. Lee with specifically the breast cancer guidelines, but I am well aware that you as oncologists have embraced acupuncture in terms of many treatment guidelines for the reduction of chemotherapy and radiation side effects. And we are very, very excited about this. And we are delighted to see the physicians coming with us and partnering with us to move forward. We do know the National Center for Complementary and Integrative Health calls it just that, calls it integrative medicine. We acknowledge the amazing breakthroughs that medicine has moved forward in terms of oncology, and also integrating, meaning truly what you are trying to do, Dr. Dodani, what Deborah is excited about, what Lisa is trying to do, what all you people on the call are trying to do, which is to integrate, to acknowledge that Western medicine is powerful and has made such amazing strides, particularly in chronic diseases, but also to acknowledge that there are certain areas where there are gaps, and that to look to acupuncture, which is a high reward, low risk intervention. And we are excited to move forward with you all and partner and see what the future brings, because I think it's going to be very bright for the patients.
Absolutely, absolutely, Judith. Thank you so much. After this meeting, I will send you an email so that we can talk, offline. I will also connect you with my associate director. I was able to recruit one person in the center, so the center consists of three people now. So Rhonda Hoos, she's a nurse by background. She's the associate director for the implementation science division of the center. And we have so many things going on. It would be nice to connect with you and Lisa. So thank you. Thank you once again.
Yes, thank you,
Our
Judith.
pleasure.
That's very, very poignant. That's the point of all this is for everyone to collaborate and connect.
And
So,
have
so
fun.
yeah,
It's just so
this was
fun to work
great.
with
I'm
everybody.
I'm excited to bring this to patients. I mean, I've been getting acupuncture for several years, so I know the benefits. And can you all of you, anyone who has a story from a patient, like that I think a lot of people on this call would really appreciate that type of the impact that you're making with individuals, cancer patients in clinic. Do you have one, Lisa?
Oh, sure, certainly. So I didn't know if anyone else wanted to jump in, but yes. So our intervention with cancer patients has been very, very powerful in that when we get a call for a cancer patient, we get them on the schedule as soon as possible. And I do have a number of patients right now that are in cancer treatment, and they're having multiple issues going on, and even despite all of their pain and difficulties, they always make it to clinic, and they're always happy to be there and receiving acupuncture. And we're able to connect them with care with Ben, and give them some additional support there, also with our staff psychologist with Linda Strasta. So we do provide more of a wraparound support during a very stressful time for patients when they're experiencing cancer treatment. And I think, one of the things I hear most frequently is they said, "I didn't know this was available." And so there are some physicians that are our champions that refer to us, and so we're really seeing a small percentage of just our patient population, but a lot of people, even after 2011 being here, are surprised to find acupuncture in a hospital setting.
Right.
And we're happy to be working with this population because most of our patients are from an underserved population, and so they would not be able to afford acupuncture if they were not able to receive it in our clinic. So I don't have a specific case for you, but I do have a number of cases. One case in particular is somebody that's kind of has liver cancer and end stage, like renal disease, and so he's challenged in many ways, and had a long history of substance use disorder, and so uh, he's still hanging in there. I mean, he's still coming to all his treatments, and I've noticed his mind shift and his outlook kind of shift to more of a positive expectation, really. And so it's a pleasure to work with him and see him talk about his family and the family support that he's receiving now, and reflections on his life. And these are really rewarding times to be with people and providing care for them in their times of need.
If I may add, one thing that's exciting to hear, about Lisa, what Lisa's saying, is that so patients who come in for acupuncture, even if they come in for pain reduction, they also, report the benefits. In my angina study, this is our second angina study. It's currently in R01. It's two site, UIC and UCLA, and in this study, not only are participants having a reduction in angina symptoms, but they report they're sleeping better. They report they're less anxious, less fatigued. And they'll report issues that to a Western physician really don't have anything to do with what you're treating, which is they'll say that their eyesight is better, their digestion is better. We know because acupuncture is a holistic treatment that if you treat one problem, you're treating all problems. We actually talk about a branch and a root treatment. So the if someone comes in, let's say for sinus problems, and we will treat the root, which will be a funny name. It may be something like, wind damp cold, but it will also treat the branch problem, which is the sinus condition. So we treat both. And so we know that so acupuncture is based on energy, and we understand that there's an energetic imbalance, and it's us as acupuncturists, it's our duty to assess the patient, as Lisa articulated. Some of the assessments are just like Western medicine, other assessments are quite different. As you all probably know, we assess the pulse, but we don't just assess the pulse, is it regular or irregular? We assess the pulse on both arms, on both wrists, in three different positions. And we get and three different levels on both sides. So that's 18 positions. We also assess the tongue, which we know is very sensitive to changes in energy. And we take all that information and we do what's called a pattern diagnosis, the pattern of an energetic imbalance. So we know in acupuncture that there may be five different, let's take high blood pressure. There may be three or four patterns for high blood pressure. And so we know, therefore, once we've assessed the pattern, what acupuncture points to use. And so this is why oftentimes when we treat one system, all systems benefit. Pardon me, the whole body benefits.
Yeah, it's true. It's truly a very comprehensive, and I feel like every time I visit the acupuncturist, it's almost like a mini therapy session too, because it's
Mhm.
just the acupuncturists are so great at listening and honing into, what's going on to be able to treat that problem effectively. So it's really a great experience to get acupuncture. I encourage everyone to try it. It's not too expensive. You can find places that do acupuncture for under $100. But yes, for our patient population, it is very tough to access therapy. So I'm glad, again, just so glad we are bringing these people in. So Dr. Wallery, Dr. or Sean Wallery, I'm not sure if you what credentials you have is talking about lifestyle medicine too. And yes, this is acupuncture helps with digestion and nutrition, helps with sleep, can help with tobacco cessation, right? All these different things. So Sean is talking about lifestyle medicine. You want to speak up, Sean, and kind of bring up what you were talking about in the chat? I think you're still on mute. Um, well, he said he's starting his path in lifestyle medicine. It's evidence-based and has great practitioners. Um,
Mhm.
and he is the state stroke vice chair and responsible for creating education and information on lifestyle medicine for physicians, patients in the state. And I think wants to incorporate this into all of that as well. I see Dr. Ganshaw has joined our call. She is
Mhm.
our director of cancer prevention survivorship and working at Miles Square with the individuals in these research studies. So you have some comments, Dr. Ganshaw? I know you just joined.
Yeah, I'm so sorry. I had competing meetings. Lisa, I was actually at a meeting at County with the Prep Med section. So Lisa and I go way back, but I'm so glad that you were here to present. And these services are so important. And trying to find what I struggle with. A lot of my patients, I think, would really benefit from these services, and I'd love to get them over to you, Lisa, because they can't pay for them. And I'm also just not sure what the quality of the services are. I don't know, I don't know how to vet what's out there, right? And maybe you guys already talked about this. I'm sorry if I'm coming to this conversation late. But I struggle a little bit, trying to find resources that are close to patients, like in their neighborhoods, but then sort of, understanding how to evaluate the quality of those. So would love your thoughts on that, unless you guys have already had that conversation.
No, Pam, we haven't, and it's good to see you. I will interject here quickly that my first introduction with research was coming on board with Pam, and when she was, say, here at Stroger, working with preventative medicine. And it was an intervention with the acupuncture and yoga or mindfulness for pain reduction. And as far as finding resources, sometimes I'll refer patients to a group acupuncture. It's a little more cost effective for them, and there are some websites you can look on for group acupuncture near me, and then see if that anything comes up from there. I do encourage patients to check the credentials of the acupuncturist, and there's a website where they can check if somebody's NCC AOM certified and to provide services. So those are some of the things I would usually check for.
Yeah, that's how I started in acupuncture, actually, in the community clinic. It's a great paradigm I started up in Northside in Uptown with Tina, that acupuncturist Pam that you wanted me to get in touch with during my permanent residency. So she was a practitioner of Japanese Chinese medicine, and she had an community acupuncture clinic, and it was very, very reasonable to start going there. It's the whole idea. She told me, well, my acupuncturist there told me that it's kind of based in the idea that groups of individuals create more energy, like thinking about being at a concert or a congregation. There's a lot more flow of energy there. So having an open concept really lets everybody kind of feed on that. Can you talk a little bit more about that community acupuncture?
Yeah, yes, Debbie. That's exactly it. There is a group dynamic that happens when people are gathered with one purpose, and so this concept of being in a room together and receiving treatment, and then this was kind of first pioneered with the NADA protocol, which is the National Acupuncture Detox Association, and they started a protocol back in the '70s to treat heroin addicts and things in the Bronx, and they were really kind of the first pioneers of this group concept. And so they would do an ear auricular system. They would just have people in recliner chairs, and they put on some, music and turn the lights down, and they would just have this hour, immersed in this, meditative kind of state. And then after that, then they would have their group therapy. And so that's kind of why I think where the initiation of this group came from. And then it's been expanded now to offer group clinics that just treat the whole body. And so you might find yourself in a room with, a half a dozen other people, but people are coming for different conditions.
Yeah. Yeah, it's a really interesting product, but very effective. And, it doesn't really diminish the effects of the acupuncture at all, which is kind of what you would think, like, oh no, I'm going to be doing it with multiple people. M.
Oh,
Wang, do you want to speak up, M. Wang, about Reiki, EMDR, and sound baths? And how,
Code Blue, lower level basement, at the front entrance of.
oh, someone's not muted, I think. Um, I was just reading in the chat, M. Wang had some comments about how do we refer to this. Oh, they can't unmute. So, like what was Dr. Ganshow was kind of talking about, trying to find a reputable provider of acupuncture in the community somewhere nearby where you live, like Lisa said, finding someone who's certified via the NDDOM was
NCCAOM,
NCCO. What does that stand for? So we
a
can.
National College of Commission of Acupuncture and Oriental Medicine.
Okay, good.
It's
Yeah.
national
Finding,
certification.
finding certified providers. They should by all means have that advertised, or when you call to make an appointment, they should know. Uh,
Yes.
yeah.
Um, good
So,
af-
uh-huh.
Hi.
Hi,
I'm
Sean.
so sorry, Sean Wellery here. I apologize. I am technologically challenged and I could not unmute, so I don't want to interject here, but I didn't want to be, seem like off-putting by not answering, so I'm sorry about that. The American College of Lifestyle Medicine, yeah, absolutely. I think this is one of the wheelhouses, right? It is a lifestyle medicine group with over 10,000 members. Absolutely, just dynamic, very strong in a lot of different groups and clubs and things you can do and join, and learning how to transfer that information to other colleagues. And we're always looking, or not just that, but I through my other groups are always looking for new information and new ways to treat people and provide services. So this has been a fantastic lecture. I can't thank you enough for putting it together and the talk and learning a little bit. I do have one question about the credentialing of it, or not credentialing, but so I am a neurologist because you asked about the credentials in my background. And so, but before I was a neurologist, I was a chiropractor. I'm still licensed, but in any event, I've never taken an acupuncture course, so I'm not the person that really understands it. But within our profession, and this goes to the credibility credentialing, there's courses you can take that credential you for 100 hours. And so, there's practitioners out there who might say, hey, I'm an acupuncturist. And I just have never really felt like that might not be like enough time, energy, experience to really be able to treat individuals. I just was wondering kind of what type of training do you think people need to get through or go to other than, just the certification? How does that work?
Yes, that's a very good question. There is a variety, quite a variety of hours for certification for acupuncture, and as a licensed acupuncture, Judy and I both attended the same college, Midwest College of Oriental Medicine, and that was over 3,000 hours. I think 3,500 hours in acupuncture, and just acupuncture alone for that certification. So there's that, and when you're seeing somebody with that certification, they have that number of hours. And then, I have seen these courses that are for like 100 hours as kind of like an adjunct therapy that are being offered. And when they talk about adverse events and pneumothorax, things that can happen with acupuncture, it's generally with somebody that hasn't had much experience and has taken these abbreviated courses. So that can happen for medical professionals that would like to be licensed. There is the Medical Acupuncture Association, and they have a journal, well respected, and they have a certification program that's, I think, more like 500 hours. You bring all of the Western medicine and your credentialing to the table already, and then they have this additional coursework that you can do, and it's with other medical professionals. So if you were looking for a certification, that would probably be the best recommendation that I would offer.
Thank you so much. Well, I'll be outreaching to you all to make sure that we get you on some speaking discussion talks and things like that. So thank you.
Yeah, I know we could talk about this all day, to be honest. All of us would love to continue this discussion. I know I have a meeting at 10, and many people do. So thank you so much, Dr. Seaman, for coming and sharing this with us and educating us. And we should all connect. So anyone that wants to connect, wants to continue this discussion, feel free to email me. I will send out a recap with, just send me your slides, Lisa, and I'll get the recording up on YouTube. So thank you everyone for coming this morning. And yeah, looking forward, like you say, to collaborations. Looking forward.
Okay. Thank you so much. Thank you so much, everyone.
Bye.
Okay.